Hi, I'm Corey, and today we'll be talking about peritonitis. So, what is peritonitis? Peritonitis is essentially the redness and swelling of the inner lining of the belly, or the peritoneum, as it's known as. The most common causes of peritonitis are an infection from a hole within the intestines or by a burst appendix. This requires immediate medical care due to the fact that the infection can spread into your bloodstream and cause sepsis, which is very dangerous. It's quite common. There's upwards of 200,000 cases a year within the US. Causes. So there's two main classifications of causes for peritonitis, and that is chemical and infectious. So chemical causes are usually secondary infections, and infectious causes are usually primary infections. So the difference between these two is that a primary infection originates within the peritoneum itself, and a secondary infection originates elsewhere in the body. Chemical causes that are pretty common are bile leakage from the gallbladder, which causes a perforation in the tissues, and pancreatic enzymes can also leak from the pancreas, which can inflame the peritoneum. And another common chemical cause is the rupturing of tumors or cysts. Some infectious causes are SBP, spontaneous bacterial peritonitis, which is the buildup of fluid within the abdomen that becomes infected by bacteria. Contaminated medical instruments are also another common cause of peritonitis. Symptoms of peritonitis: mild severe abdominal pain, swollen abdomen, dehydration, paralytic ileus, or the paralyzation of the muscles that help food be pushed through the intestines, fever, nausea, shortness of breath. And if you have ascites, you may also experience mild cognitive impairment, fatigue, swollen legs and feet, and you may bruise and bleed easily. Diagnosis and treatment. So typically you'll need a physical examination to see if the abdomen is hard and painful and to see if there are any bowel movements or sounds. You'll be checked for signs of shock, including low blood pressure, abnormal pulse rate, and pale skin. Blood tests will be taken to check for which strain of bacteria is responsible for the infection. A laparoscopy, which is the insertion of a slender tube into the abdomen via incision, just to examine the insides and get a better look at how the peritoneum looks and what the infection is causing. And you also need a peritoneal fluid culture, which is a sample of fluid taken and examined for signs of infection. Treatment is usually hospitalization in an intensive care unit because of the severity of this condition. You'll be given antibiotics tailored to the specific bacteria causing the infection. You'll be given intravenous fluids to rehydrate your body and replace the electrolytes. And in some cases, you'll need surgery to repair the ruptured organ and to wash out the abdominal cavity of blood and pus. Prevention. The best way to avoid peritonitis is to maintain a healthy diet and address underlying conditions that are known to cause peritonitis, such as a perforation of the gallbladder or pancreatic conditions. Other than that, sterile work environment by medical professionals is also very important due to bacteria on instruments getting into the intestines and causing peritonitis. Here are my sources.